Cancer is, without question, one of the most formidable health challenges faced by individuals and societies worldwide. While much attention is often focused on the physical manifestations of the disease, the tumors, the treatments, the side effects, the profound impact that cancer has on mental health is sometimes overlooked or underestimated. Yet for many patients and their loved ones, the psychological and emotional burden of cancer can be as significant, if not more so, than the physical toll. Understanding the intricate ways in which cancer affects mental health is crucial, not only for providing comprehensive care to those affected, but also for fostering empathy and support within families, communities, and healthcare systems. The diagnosis of cancer is frequently described as a life-altering event. For many individuals, hearing the words "you have cancer" initiates a cascade of emotions: shock, disbelief, fear, anger, and sadness. The initial psychological response is often characterized by acute stress, as patients grapple with the reality of their diagnosis and the uncertainty it brings. This period is marked by a sense of vulnerability and loss of control, as one's future suddenly seems unpredictable and fraught with danger. Many report feeling as though their life has been divided into a before and after, with the diagnosis serving as a stark dividing line. As patients begin to process their diagnosis, anxiety often becomes a dominant emotion. The fear of death is a natural and common response, but anxiety can also stem from concerns about pain, disability, financial hardship, and the impact of illness on loved ones. The unpredictability of cancer, its potential to recur, its variable response to treatment, and the possibility of complications can lead to chronic worry. For some, this anxiety is manageable. For others, it becomes overwhelming, interfering with daily functioning and quality of life. Depression is another frequent companion of cancer. Studies consistently show that rates of depression are significantly higher among cancer patients than in the general population. The reasons for this are multifaceted. The physiological effects of cancer and its treatments can disrupt brain chemistry, contributing to depressive symptoms. At the same time, the existential threat posed by the disease, combined with physical debilitation, social isolation, and changes in self-image, can create a fertile ground for depression to take root. Patients may experience persistent sadness, loss of interest in previously enjoyed activities, fatigue, feelings of worthlessness or guilt, and suicidal thoughts. It is important to recognize that depression in cancer patients is not simply a normal reaction to a difficult situation, but a serious condition that warrants attention and intervention. The mental health impact of cancer is not limited to patients alone. Family members, caregivers, and close friends often experience significant psychological distress as they watch their loved ones struggle with illness. Caregivers, in particular, are at elevated risk for anxiety, depression, and burnout. The demands of providing physical and emotional support, managing medical appointments and medications, and coping with the uncertainty of the future can be overwhelming. Many caregivers feel isolated as their own needs and feelings are overshadowed by the focus on the patient. This phenomenon, sometimes referred to as caregiver burden, can have lasting effects on mental and physical health. The stage and type of cancer, as well as the prognosis, play a role in shaping the psychological response. For example, individuals diagnosed with cancers that have a high likelihood of cure may experience less long-term distress than those facing advanced or terminal disease. However, even those with favorable prognoses are not immune to psychological suffering. The fear of recurrence, a persistent worry that cancer will return, can linger long after treatment ends, casting a shadow over daily life. This fear can be particularly pronounced during follow-up visits or when experiencing new or unexplained symptoms. Treatment itself can be a source of psychological trauma. Chemotherapy, radiation, and surgery often bring with them a host of physical side effects, such as pain, nausea, fatigue, and changes in appearance. These effects can erode self-esteem and lead to feelings of embarrassment, shame, or hopelessness. Hair loss, weight changes, and surgical scars can alter body image and sexuality, affecting intimate relationships and self-identity. Some treatments may also cause cognitive changes, sometimes referred to as chemo brain, which can include memory problems, difficulty concentrating, and slowed thinking. These cognitive effects can add to the frustration and distress experienced by patients. Social support is a critical factor in buffering the psychological impact of cancer. Patients who have strong networks of family, friends, and community resources tend to cope better with the emotional challenges of illness. Support groups, whether in person or online, offer opportunities for sharing experiences, expressing emotions, and receiving practical advice. However, not all patients have access to such support, and some may withdraw from social interactions due to fatigue, depression, or a desire to protect others from distress. Social isolation can exacerbate feelings of loneliness and despair, creating a vicious cycle that is difficult to break. Cultural beliefs and values also influence the experience of cancer and its psychological impact. In some cultures, cancer is associated with stigma or shame, leading patients to conceal their diagnosis or avoid seeking help. Others may view illness as a test of faith or character, which can shape coping strategies and emotional responses. Healthcare providers must be sensitive to these cultural factors when offering psychological support, recognizing that one-size-fits-all approaches may not be effective. Spirituality and existential concerns often come to the forefront during the cancer journey. Many patients grapple with questions about the meaning of life, the nature of suffering, and what, if anything, lies beyond death. For some, spiritual beliefs provide comfort and a sense of purpose, helping them to find hope and resilience in the face of adversity. For others, the experience of cancer may trigger spiritual distress, including feelings of abandonment, anger at a higher power, or loss of faith. Addressing these existential concerns is an important aspect of holistic cancer care and can be facilitated through counseling, pastoral care, or conversations with trusted spiritual advisors. Children and adolescents with cancer face unique psychological challenges. The interruption of normal development, separation from peers, and disruption of schooling can have long-term effects on mental health and social adjustment. Young patients may struggle to understand their illness and its implications, leading to confusion, fear, and behavioral changes. Parents of children with cancer often experience intense guilt, helplessness, and anxiety as they navigate the complexities of treatment and attempt to maintain a sense of normalcy for their family. Older adults with cancer may encounter different psychological hurdles. Many are dealing with multiple health issues, loss of independence, and concerns about being a burden to others. Cognitive decline, grief over the loss of peers, and financial worries can compound the emotional impact of cancer. For some, the experience of illness prompts reflection on life achievements, regrets, and unresolved relationships, which can bring both comfort and distress. The intersection of cancer and pre-existing mental health conditions is another area of concern. Individuals with a history of depression, anxiety, or substance use disorders may be more vulnerable to psychological distress following a cancer diagnosis. Conversely, the stress of cancer can precipitate or exacerbate mental health problems in those with no prior history. The bidirectional relationship between cancer and mental health underscores the need for integrated care that addresses both physical and psychological needs. Access Access to mental health services is a critical determinant of outcomes for cancer patients. Unfortunately, many face barriers to obtaining adequate psychological support, including lack of insurance coverage, shortage of trained professionals, stigma, and logistical challenges. Integrating mental health care into oncology settings through the involvement of psychologists, psychiatrists, social workers, and counselors can help to bridge these gaps. Screening for distress should be a routine part of cancer care, with referrals to appropriate services as needed. Pharmacological interventions, such as antidepressants and anxiolytics, can be effective for some patients, particularly when psychological symptoms are severe or unresponsive to other approaches. However, medication should be used judiciously, with careful monitoring for side effects and interactions with cancer treatments. Non-pharmacological interventions, including cognitive behavioral therapy, mindfulness-based stress reduction, supportive counseling, and expressive therapies, such as art or music therapy, have demonstrated efficacy in reducing distress and improving quality of life. Palliative care, which focuses on relieving suffering and improving quality of life for patients with serious illness, plays a vital role in addressing the psychological impact of cancer. Palliative care teams are skilled in managing complex symptoms, facilitating difficult conversations, and supporting patients and families through transitions in care. Early integration of palliative care has been shown to improve not only physical symptoms, but also mood, coping, and satisfaction with care. Survivorship brings its own set of mental health challenges. For many, completing treatment is a time of celebration, but it can also be accompanied by feelings of emptiness, anxiety, and loss. The structure and support provided by regular medical appointments suddenly disappear, leaving survivors to navigate a new normal on their own. We hope this video is helpful for your understanding of cancer care. Stay tuned.